Good morning, everyone. So today we are going to start with the medicine and pediatric instruments. So first one is lumbar puncture needle. So as you can see in this diagram, this is lumbar puncture needle. So it has metallic one which is old. The newer one is plastic one. So higher the gauge we go, the thin become the needles. So what is the site for this for the lumbar puncture? That is L3, between L3 L4 or L4 L5. Any site basically below the L2 level, right? How to identify that this is L2 or L3 space, right? If you keep your both fingers on the iliac crest, then your thumb is at the level of L2 L3. So this is how you can get that this is the level where below which I can do lumbar puncture, right? Needles beveled edge up should be there. Structures pierces from out to in. So first of all, the skin, then the subcutaneous tissue, then supraspinous ligament, as you can see in this diagram, the supraspinous ligament, this one, and then interspinous ligament. That first of all, supraspinous, it means that above the spine, then interspinous, in between the spinous process of vertebrae, then ligamentum flavum, as you can see this ligamentum flavum, then dura and then arachnoid matter, and now you can reach in the subarachnoid space. So here the CSF is present, so here is the CSF present, and now you can take up the CSF. Okay, so prerequisite for doing the lumbar puncture: manometry, to check the CSF pressure. As if there is increased in the CSF pressure, it is an absolute contraindication to do lumbar puncture, because due to the risk of herniations, right? So prerequisite is to check the CSF pressures, right? Next one is collect 1 ml. We have to collect 3 ml basically, 1 ml in each 3 vials. First vial is for the culture and gram staining. Next vial is for glucose and protein measurements, and tube 3 or the vial 3 is for cell count and differentials, right? So this is the prerequisite and the way we have to do the lumbar puncture, right? Then the indications, for what indications we are doing the lumbar puncture. There is diagnostic indications as well as therapeutic indications. Diagnostic indications including if we are suspecting any meningitis or meningoencephalitis, right? Then we have to do lumbar puncture to rule out which type of meningitis is that it is bacterial, viral, fungal, tubercular, that we have to differentiate this, right? Then if in case of any CNS metastasize, in case of any leukemia or lymphoma, we have to check that there is any CNS mets or not, right? Then for the therapeutic indications, right, for anesthesia, we do lumbar puncture in the case of pseudotumor cerebri. What do you mean by pseudotumor cerebri? It is a benign increase in the intracranial tension, right, due to hypervitaminosis A and D. Next is to give intrathecal methotrexate in case of the ALL, right, acute lymphoblastic leukemia, right? So these are the indications for this, diagnostic indications as well as therapeutic indications. Next one is position. I already told you that site for this, right? That L3 or L4, between L3 and L4 or L4 or L5, right? How we measures it, this is this, right? Iliac crest and all. Next is a position, that lateral position or sitting if big child, right? Lateral position होनी चाहिए patient की या फिर sit होएगा.